requires that I notify the public that this meeting is being recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made and broadcast by Boston City TV, which is a part of the City of Boston Office of Cable Communications. And as you all can see or hear, we're doing things a little differently this time. I am currently the only one. My name is Jessica Dunan. I'm the Chief of Staff for the Disability Commission. As you may be able to see, and also from the people behind me, currently, now we've got even better audio. So I'm Jessica Dunan. I'm the Chief of Staff for the Disability Commission. And as you can see, I am currently the only one in City Hall with the cable communications staff. We're going to be hosting this meeting virtually, so please bear with us while we handle some, what I'm sure will be some glitches along the way, but hopefully we'll be able to get through this meeting as speedily as possible. Zari, I see your question about how long the meeting will be. We're hoping it'll run until, I would imagine, until about 7, maybe a little bit less time. And so for ease of communication, I'm going to call everybody's names. I'm going to go simply down the commission members list that is alphabetized by last name in front of me on my laptop. And we'll ask each of you to unmute yourselves, say who you are and what neighborhood you're from, and then mute yourselves again. And so I'm also going to mute myself so that, and unpin myself so that other people will be able to come on and be on the screen. So first we have Zari Amir Husseini.
Hi. Hi, this is Zari, and I'm calling from South Boston.
Great, thank you so much, Zari. Jerry Boyd will be with us in a moment, so can I have Paul Karen, please?
Hello. Hello, everybody. Paul Karen. I represent West End, Beacon Hill area, worker for the BPDA. I hope everybody's safe and well.
Great. Now we move on to Elizabeth Dean Clower.
Elizabeth Dean Clower, representing Back Bay, Vice Chair, and I will preside until Jerry is able to join us.
Great, thank you so much. Next, we have Wesley Ireland.
Hi, this is Wesley Ireland here. I represent the North End. Thank you.
Great, thank you so much, Wes. Next, we have Dusia Lebovskaya.
Hello, my name is Dusia Lebovskaya, or Dusia L for short, and I am representing Mission Hill, and I'm the treasurer. Thank you.
Thank you so much, Dusia. Next, we would have Juan Carlos, but he unfortunately sends his regards. He's working on a project for MGH related to COVID, so he isn't able to come be with us tonight. Next, we have Olivia Richard.
Hello.
Hi. Yeah.
I am Olivia Richard, and I represent Brighton. Live from my bed.
Perfect. Thank you so much. Next, can I have Carl Richardson?
Hello, this is Carl, representing Brighton, Massachusetts. I hope everybody is well and safe.
Thank you so much, Carl. Now, Kyle Robidoux.
Hi, Kyle Robidoux. I live in the Roxbury neighborhood of Boston.
Great, thank you so much. And now we'll do a quick overview of the staff that are here. Commissioner?
Hi, I'm Krista McCosh, the Disability Commissioner and ADA Title II Coordinator for the city.
Great, thank you so much. And I believe I will just go through all the names of our staff that are on so that we don't have to keep popping everybody up. So we have Patricia Mendez, who will give the architectural access update later. We have Chris Moravsky. We also have Sarah Leung, Melinda Andrade, and I believe that is all the staff we have right now currently from our office. I know that we also have a couple members of the public as well. We will have time for public input at the end if the public does have something they'd like to bring up to the board. And now I hand it over to Elizabeth to begin the meeting.
She's on mute.
I just realized that. I apologize. So we do again want to welcome everyone to this opportunity to meet for our April meeting. And the next item on the agenda is to approve the February minutes. Those were sent out to everyone. So do I hear a motion regarding the minutes?
This is Carl. I make a motion to approve the minutes.
Is there a second?
This is Ducia, and I second.
Quick or is there, if it's where people have had any amendments, would present them, or any edits, or we're voting as is to adopt the minutes as presented?
I believe we're currently voting to adopt them as is.
Okay. All in favor?
Aye.
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 Any opposed?
Aye.
Zari, was that an aye to affirm them or oppose them?
Approve.
Great, thank you.
With that, the meeting minutes are approved, and we will now move on to the COVID update, the COVID-19 update.
Great, Commissioner, do you want to introduce the speaker?
Sure. Hang on one second. Actually, can you do it, Jessica? My phone's ringing.
Sure, no problem. So we have on the phone currently, we have Rita Nieves, who is, correct me if I'm wrong, Rita, the Interim Executive Director for the Boston Public Health Commission, and here in the city of Boston, and so she'll be speaking to us related to the COVID-19 public health emergency and what the city's been doing, and she'll take a couple questions at that point as well. It's all you, Rita.
Thank you, Jesse, and thank you, Commissioner Akash, for the invitation and the opportunity to join you. I hear an echo on my end. Are you hearing it too, or?
We don't hear it, I don't believe.
Okay.
I hear it.
You do? So it
Yeah.
must be that there's maybe somebody is also connecting via cell phone on the call, via call, and then also have the Google video on, and those two, if they're too close together, it creates that kind of a reaction. But I don't.
Better now, Rita.
Yeah, it seems to have stopped, so that's good. So let me know if at some point you don't hear me well. So thank you again for the opportunity to join you in this meeting, and happy to provide a quick update and then take some questions. For those of you who are not familiar with the Boston Public Health Commission, we're actually the oldest city health department in the country. So we've been around for a little bit, and we have the responsibility of obviously responding and leading the efforts around the response to to any situation such as the COVID-19 pandemic. So we have been at this since mid January, and and obviously the responding to an outbreak or outbreaks that we have here and there sometimes in our city is one of the core public health functions that we do. So, responding to a pandemic is our first time, and probably, hopefully, it'll be the only pandemic that we all have to see in our lifetime. And we have what we call the Medical Intelligence Center, which is like the organizational structure within the Boston Public Health Commission that has the expertise and the structure to help us organize how we respond to this public health crisis. And because we were one of the first 5 cities that identified a case, we were actually the 5th city that reported a case of COVID-19, and that was literally, at the end of January. We had a good head start in terms of, having the opportunity to do planning and preparedness to mount a response. So since mid-January, we've been both preparing and then later on responding to the pandemic here at the local level. Boston is very fortunate, and it's, we're a very unique city, which has contributed to our ability to have a robust response to this pandemic. We are a center for healthcare with many hospitals, as you know. We practically have a community health center in each neighborhood, and that network and that landscape of healthcare settings and facilities that we have in the city of Boston, in my opinion, has contributed a lot to Boston being able to respond effectively to the pandemic. The numbers are, as they stand right now, numbers are usually updated at the end of the day, every day. So as of yesterday, the numbers in the state of Massachusetts were a little bit over 41,000 cases in the entire state. And they also have reported so far 1,961 deaths. In Boston, again, as of yesterday, we have reported 6,010 cases. We also report on how many people have recovered. And as you know, at least 80% of the people who end up being infected with the coronavirus can recover and can recover fairly quickly with very mild symptoms and outcomes. So we report on a daily basis how many people are in that category. So out of the 6,000 people in Boston that have been found to have been positive to COVID-19, 1,142 has so far recovered without any consequences. And we also have reported 196 deaths in the city. I'm sure, we all have been bombarded with a ton of media coverage around COVID-19. So I feel like, lots of people have, a good level of knowledge as to how we're managing and how we're monitoring the situations, both at the local, state, and national and worldwide levels. So you probably have seen a lot of data and images around the often mentioned curve. And so we have been using a model to predict and project what to expect in terms of the pandemic here in Boston. And it's a model from the University of Washington. And no model is perfect. And, all models make lots of assumptions as to how things are going to look in a particular city or state. So based on the information we have, it seems like, in all the efforts that we have put forward in the city of Boston, from all the measures around social distancing, all the different closures of different places, businesses, the school system, and everything that is non-essential, we have been able to really have an impact on that curve and really avoid having a very drastic peak in the city of Boston. And as a result, what we're looking at this week is that curve has really, it's really hitting a plateau, which means that, it's good that it wasn't a sharp curve, but then it means that we're going to be at a high level of cases, and stuck on that plateau for a few more days. And therefore, our response will have to be, consistent with what we're seeing. And so we're going to be operating at a high level of a response for a while. So that's good news in the sense that, again, we've been able to, it seems like so far we've been able to avoid all those very drastic and very dramatic cases we've seen in other cities in which hospitals have run out of beds, have run out of ICU beds, and have run out of essential and critical equipment such as ventilators. As I was saying before, we're very fortunate that we have a very experienced, we have the best hospitals in the nation, and very experienced professionals and leaders in the field that train on this and that prepare for this type of contingencies all the time and had time to prepare and time to create additional spaces within the hospital. And so far, we are seeing, hospital beds filling up and expanded capacity being used. But again, we've also seen a lot of collaboration between hospitals, helping each other, admitting clients that are coming from other hospitals that are filling up. So it's good to see that there's a lot of that happening. And as a result, the hospitals so far have been able to manage what has come their way. It is our job to collect the data around who's being affected by COVID-19, and the data do not come directly to us. The data goes to the Department of Public Health, and from the Department of Public Health, it gets then shared with all the other cities and local boards of health. So as a result, when it comes to racial and ethnic data, our data in Boston right now has only 70% of the cases we have contain information on race and ethnicity. And we're only missing 30% because when we get the data from the state, it's usually missing 70% of the racial and ethnic field. So our staff and our public health nurses, do a great job. I continue to find ways to fill in the gaps so we can get a more complete set of data, and so we can also have a more complete picture of how COVID-19 is impacting the residents of Boston by race and ethnicity. Right now, in terms of the percentage of cases that we have in Boston by race and ethnicity, the highest number of percentage of cases are associated with Black and African Americans. 42% of our cases are among Blacks, and 27% are among whites, 17% among Latinx, and 3% among Asians. And we have like I said, 30%. With 30% of the information is missing, and we're actually finding ways to collect that information. We also collect information around neighborhoods, and just so you have an idea, this is information in terms of what are the neighborhoods with the higher percentage of positive tests based on the tests that have been conducted. So the neighborhood of Mattapan is the one with the highest rates of positive tests. You know, they have a 48% of the tests that have been conducted and were positive are from the neighborhood of Mattapan, followed by East Boston with 47%. Some zip codes in Dorchester follow that with 42%, and Hyde Park with 42% positive rates. So in terms of some of our initiatives, you know, a ton of work is happening in the city, not only obviously carried out by public health staff, but every single department in city government is engaged in this response. We have daily calls with the mayor and all the leadership at City Hall, where we solve problems, we update each other and what we're doing, and we're doing a lot of collaboration, cross-departmental types of initiatives and collaborations. Some of the things that we have been doing in the last 6 weeks that have dramatically have an impact on, one, the number of cases we have in the city, and two, how the hospitals are being able to manage the surge of additional patients during the highest point in the curve, have to do with the fact that the Boston Convention and Exposition Center was developed as a site where we have 1,000 beds. 500 of those are respite for individuals who are homeless and are positive for COVID-19, have mild symptoms, don't need to be in the hospital, but do need a place where they can be isolated. The other 500 beds that are being monitored by partners are beds that hospitals can use for the same purpose. Instead of having people occupying beds and people that don't need to be in the hospital because they had mild symptoms, the BCEC is a place where people that fall in that category can go. So by doing that, we're really deconcentrating hospitals and then giving them the opportunity to then use the beds that they have for the acute patients and really absorb, any surge that we may see. We also have created the East Newton Pavilion as a site, and we also have a location in Brighton, which is a former hospital, where we have like another 80 beds that are being used also for people who are positive and in need of that space. We had deconcentrated some of our shelters and have placed some of our guests in dormitories. We've had great collaborations and partnership with Suffolk University, Northeastern University, and we have folks from our homeless shelters who are occupying those dorms, and again, allowing us to provide that social distancing, more social distancing, I should say, within the shelters, and being able to really, again, help minimize the opportunities for community transmission. And, we're doing also a lot of work with long-term care facilities. I'm sure you have seen in local and national media all the reports about how, nursing homes and other congregate settings have been hit really hard by the pandemic and all the huge impact it's had both in the amount of cases and the mortality rates that have been documented in many facilities. In that sense, the state in Boston has experienced the same challenges, and we're working very closely and are in contact daily with all these facilities, and we've been able to help them with infection control, giving them personal protection equipment, and also being able to help them with staffing as well, because some of them have struggled with that. In terms of I'll mention one last thing that we're doing, and it's critical. Again, I'm sure you have heard in national media, heard the word testing, and it is unfortunate that it's April 22nd, and we are still talking about lack of supplies and lack of access to testing, which is critical for us to be able to identify who are the people out there who are infected, so we can properly care for them, so we can properly do contact investigations and identify who are the people that have been exposed to that person, and appropriately, quarantine them. And so we're struggling the same way as many cities and states. However, we've continued to work on this and find ways to increase access to testing in our community. So in the last couple of weeks, we've been working with community health centers, and they have received funds from the Resiliency Fund, and we've been able to add to our list of places where people can get tested, 11 community health centers. I'm hoping that in the next couple of weeks we could add, another good 8 or 9 additional places. And as you know, community health centers are based in the neighborhoods and are really in a very strategic place, and very key place for people to access services in their neighborhoods without having to go to a hospital. So we will continue to do that work and continue to expand access to this vital piece and tool that we have to have available. And in terms of next steps, we the mayor appointed a health inequities task force to look at again, what are things that we could do to use the data that we have available in terms of who's being impacted the most by COVID-19. What are the things that the city can do? So this advisory group is helping us look at the data through those lenses, and really trying to identify strategies so we can address some of the inequities that are clear, that have been there, and especially those that we know that communities of color and other groups have been disproportionately affected by COVID-19. So what are the things that we need to do to address those issues? And lastly, we have been working for a couple of weeks on what's called the recovery phase, which we at the Boston Public Health Commission understand that for the remaining of 2020, we won't be doing anything but focusing on this. Health inequities, were here before COVID-19, and health inequities have been exacerbated by COVID-19 and will continue to be exacerbated as days go by, and we've started to feel the impact, especially around socioeconomic, in the socioeconomic area. So the recovery plan that we're working on is looking at, from a public health perspective, what is it that we need to do, and what are the services that we need to put in place to make sure that when cases go away, at least for a while, because we suspect, in the fall we may need to be ramping up some of the services again if COVID-19 comes back, during flu season. We'll have, a lot of work to do to continue to serve the communities and the residents that we work with post COVID-19. So I'll stop there because I'm sure people may have some questions, and happy to answer any questions you may have.
Thank you very much for that presentation. I know Ducia has this is Jerry Boyd, by the way, the chair of the advisory board, and thank Elizabeth for handling the early part of the meeting. And I'm from West Roxbury, and I know Ducia has a question.
Yes, thank you, Jerry. Yes, and thank you. I'm sorry, I forgot your name again. My name is Ducia. Yeah, I just have a question regarding your report. You maybe mentioned this already. However, I have maybe two questions. So the first question is there any reports or statistics or something equivalent about if any, like you mentioned, race and ethnicity. However, is there also like a data about how many people who have a disability or have been brought to hospital, COVID situation? Like, is there any percentage about how many people with a disability or a couple were brought to the hospital, and how many of them, if they're okay? And the other question I have is regarding mental health, like if they're like those who are in the hospital who are not disabled, if they have any, to say, relatives who are maybe having mental health, help from mental health counselors. Yeah, that's my question. Thank you.
Thank you, Dusha, for those two questions. So on the reports, you can go to the Boston Public Health Commission website. It's bphc.org. And in the front page, at the top, there's a banner that says COVID-19, and you hit there. And every day, you'll see there all the information we have about COVID-19 and materials that have been developed. But in that front page, you'll also find the all the data that I mentioned today. It's updated there on a daily basis. Your question about the impact of COVID-19 on people with disabilities is obviously a great one. We just started to get some specific data from the state, and unfortunately, the way that the data is collected does not ask, questions other than demographics. And as it is, the governor had to just order about a week ago that race and ethnicity data be collected as a mandatory, requirement. If you can believe that, it was not a requirement before. So, however, as I mentioned before, that we have, because we're in contact with all the cases here in Boston, eventually, they get connected with a public health nurse. We're obviously very interested in knowing, finding all the data that's missing around race and ethnicity, but, the impact on the communities who are experiencing a disability is something that we could definitely add to the information that we can gather, because obviously we want to know the impact on different groups and obviously on people with disabilities. So we'll hopefully within a couple of months, we'll be able to address some of the systems issues and see if we can get some data on this area. And obviously we'll communicate with Commissioner Makash, and maybe we'll have some idea. Maybe, you guys can give us some ideas on how to best get that information that's missing. On the mental health, our recovery plan will include psychological aid and disaster planning. So we're putting information out there for people on how to access all types of support, whether it's, for crisis intervention, suicide prevention, how to access mental health services. But this is clearly an area that we need to, it needs to be very, very important and highlighted and addressed in our recovery plan, because we know that one of the outcomes that we're going to see is an increase in people for different reasons, an increase in people experiencing and coming to the healthcare system with mental health issues as a result of all the trauma, the loss, the stress of having to deal with, the pandemic, but also the effects of the pandemic in their socioeconomic life. So Thank you for that question.
I know Elizabeth has a question.
Yes, this is Elizabeth Jean Clowert. Thank you for that update. And we are grateful that in Massachusetts there is a strong push for coordination among the different organizations, hospitals, and government, both at the city and state level. We, as leaders and members of the on this board and in the disability community, we do have strong concerns for our constituents because many people have underlying pre-existing conditions and fit into that these are not, just as others have been using the phrase, it's not either or, but and both, that many people find themselves at the intersection of a couple of these different at-risk categories, such as pre-existing condition and being from a community of color or socioeconomically disadvantaged. And I was interested to know when you described the issues of access to testing, you were using access in a more general sense, but there are even then physical barriers for some people in the disability community for whether it's transportation or other ways that I think there needs to be a different level of focus for this diverse community that we have. And I don't know if Commissioner also has, I know the Commissioner will be giving her own report, but at this juncture, if there are specific ways that that's already being addressed.
Well, no, thank you, Elizabeth. And I'm sure Commissioner McCosh may have some comments, but what I would say is that we are, like I said, we're leading the efforts around the recovery planning. And one of the things that we're, suggesting the mayor is that, and I know that it's going to happen, is that every single department within city government is going to be required to design and develop their own recovery plan based on some principles that we're going to provide, and with a public health and equities framework and lenses. So I have said to Chief Martinez, who's the Health and Human Services chief, that the Health and Human Services Cabinet is going to lead the way for the rest of city government in this response. And Commissioner McCosh will be part of that team that's going to be asked to think about, these are my constituents. What are the things that I need to consider in thinking about what are the needs people have right now that I serve, and what are the ones that I project and anticipate they will have in the next year. And everybody's going to be asked to use their networks, their consumer groups, all the different avenues and methods that people have to make sure that this is a constituent focus assessment and response. So I'm sure we'll have plenty of opportunities to talk to Commissioner McCosh about how we can support her in developing and coming up with a recovery plan that addresses all those issues that people have mentioned, and be happy to be part of those conversations with the commissioner, because we need to make sure that we don't forget about any group, and no need is overlooked, no group is overlooked. So thank you for that question.
I'll just add really quickly. Hi, this is Kristen McCosh, the Commissioner. Thank you for that point, Elizabeth. It is a very important point. The testing centers are relatively new. They were just opened, so we haven't gotten to that point yet. And like Rita said, we haven't really, we definitely will be working on a recovery plan. What we've been focusing on in the short term, in the immediate term, was access to food, access to PPE, home care, the emergent needs that the constituents have, but certainly testing is also a very important need. And where the testing sites are new, we haven't gotten to that point yet, but we definitely will make note of that and keep the board updated with any new information that we have on testing.
If I could jump in just briefly, Commissioner. Rita and I did have a quick email exchange in regards when I sent over the ADA guidelines on access to specifically mobile or drive-in testing sites. And so there has been some preliminary conversations on the accessibility of specific testing sites, really in regards to the actual access of the drive-through ones, and I'm not sure whether or not Massachusetts has drive-through ones, but it does touch on a lot of different aspects in regards to communication and physical access to those testing sites, and so that's been sent to BPHC. We've also shared a resource from Mass Commission for the Deaf and Hard of Hearing that they put together very early on, so about 4 weeks ago. They put together a card or a communication tool that allowed for screening of, for the screening process to happen if an interpreter isn't present. So it's a visual card. I think it's a front and back that has pictures on whether or not someone had traveled, whether or not they have a fever, whether or not they're exhibiting certain symptoms. And so we worked with Mass Commission for the Deaf and Hard of Hearing, Boston Public Health Commission, and also the Medical Intelligence Center specifically, like Rita mentioned, to get that information out. So ensuring access to testing has been a piece that we've been working on throughout this time, and we're in constant communication with Boston Public Health Commission, the Age Strong Commission, and any other department really that is needed in order, if there is an issue that we're aware of that comes up in regards to lack of access to, lack of disability access to testing sites and things like that.
Can I just add one more thing? I did see that email. Thank you, Jessica, for all that information. I guess one thing I was thinking of, what Elizabeth said, was the transportation piece, because I know I was on a call earlier with disability commissioners from across the country, and they're talking about lining up their paratransit services, getting Uber and Lyft vouchers for people with disabilities to get access to testing, because we know a lot of people with disabilities don't have vehicles and may be nervous to take public transportation, may not be near public transportation. So definitely getting to a testing site, and if we do have drive-through testings, getting access to get to the drive-through testing sites will be an issue. So that will be something that we'll also be working on, in addition to making sure that the testing sites themselves are accessible.
Great, thank you for that clarification, Commissioner and Jessica. And I know Olivia had a question.
Yeah, I recently spent a few days at Club Mass General Hospital for an infection that I had, and ancillary to that, they tested me for COVID-19. The process is rather invasive, and they had to test me twice plus do a chest x-ray, because the infectious disease people weren't trusting the swabs. Is this a known problem?
I suppose, every situation could be slightly different, and the decisions, the clinical decisions that a particular doctor makes around how to try to diagnose or, rule out whether somebody has COVID-19 may vary, in every situation. So I think, so I'm not sure, what was the, I cannot speak about the thinking, but we know that the virus, the presentation and how it would look in an X-ray is very particular. So maybe they were being super careful and wanted to make sure that they cover all the bases and that they had most of the information that could use them to really rule out whether whether your test was positive or not. No test is 100%, sensitive to be able to say yes, with certainty this person is positive or negative. So it is possible that there could be false positives or false negatives depending on also where the person is at. Somebody may be infected, and just because they recently got infected, maybe they're still not showing a positive test. So it could vary from person to person.
Cool, thank you.
I know Zari had a question or a follow-up.
Hi, I actually asked if the people couldn't go to the site, could there be maybe a consideration for a mobile testing where people can actually go to people's homes, or at least be closer in the neighborhood where people are?
Rita, do you know about that?
Right now, that would be, although obviously ideal for so many people, especially those that have a hard time or a challenging time leaving the home. It would be a little bit challenging right now, given the issues we're having with supplies, and two, the issues we're having with personal protection equipment. For a test to happen at home, the clinician who's doing the test would have to, put a number of equipment on, so they can safely test without getting exposed themselves. In the event that the person was positive, so it will be a little bit challenging to do that right now. Maybe at some point, if we have more supplies for testing and more PPE, and more staffing that could do that would be a very ideal, obviously, model for people who are homebound and it's harder for them to leave the house.
Can I add one thing to that? Zari, I don't know if the board has heard of the Boston Resiliency Fund. I believe Rita mentioned it briefly, but it's donated money that is going to be used to support organizations in response to the COVID outbreak. And one of the initiatives that got funded that the mayor mentioned today was a telehealth project through the community health centers. So I'm not sure what services they have, and I wouldn't want to speak to say anything about the testing, but they will be piloting some telehealth programs. So that will be communicating with doctors over the phone. And I know there's been a push for telehealth during this pandemic. So the more we can reach people where they are, the more we will. And like Rita said, testing may present its own unique challenges, but the move to be able to treat people off-site is definitely becoming a priority. So we will keep that in mind, just as part of the conversation, if there's any way we could ever do that.
Yes, and I did just want to follow up myself. This is Jerry. In terms of, I do know that there is a mobile site right now in Hyde Park, and I wanted to ask Rita, I know Hyde Park was one of the neighborhoods where there was a high concentration of positive tests based on your report. What neighborhoods are they planning on going next, and to next, the mobile site, and how can we follow up and know where the mobile testing is taking place besides the community health centers?
So the Hyde Park testing site is being sponsored by the Brigham, and they intend to stay in Hyde Park until Saturday. And what I was told is that then they'll move that testing site to Mission Hill They're trying to identify areas where, based on the data, they feel that there's been lack of access to testing. So that's how they're making those decisions. I will be happy to share the contact for the Brigham with Commissioner McCosh in case she wants to connect with him. And if you have any suggestions, in terms of, whether they could stand a site in a particular place that you feel that they should go to. So I'll be happy to share that contact. But that's the plan, and I think, how many more neighborhoods they plan on visiting, I'm not sure, because they're just looking at the data on a weekly basis and then going by that. And because testing is ramping up quickly in so many places, we're going to be seeing, our numbers, testing numbers go up. I hope dramatically in the next couple of weeks. So they'll keep an eye on where testing is happening, and they're going to try to go to places where there's not much going on, or they need to enhance it, and that's how they're making the decisions.
Great, and I know the commissioner had a follow-up question.
Rita, do residents have to be exhibiting symptoms still to get the test? I know they were being really strict with that when the test first came out. Like, do you have to have the cough and the fever and everything, or can you get a test if you were just exposed?
So, so you understand the rationale. Most health centers and places are only testing symptomatic individuals. And again, the reason for that is because we are so behind. The last numbers I saw for the amount of tests that have been conducted in Boston was 15,000, 1-5. Now, you know what the population of Boston is, right? So 15,000 tests. That accounts for the neighborhoods that where testing has happened, based on people's zip code. It's like 1.5, less than 2% of the population of each neighborhood. So that's obviously, those we can only go up from there, right? And and then the fact that there's so many people out there that are symptomatic, in need of a diagnosis, and the fact that because of that too, DPH put out guidelines that we have to follow, in terms of what are the categories of people that we need to prioritize. We are sticking with testing as a priority people who have symptoms. Once we have more supplies and once we have more testing sites out there, the moment will come, and already it's sort of there. There's Whittier Street, I understand, is testing some community folks that are coming. I think they have to have at least one symptom, but the moment is going to come where community testing is going to happen. And by that I mean, a testing site is going to be put up in X neighborhood, and anyone who wants to know whether they're positive or negative or they have been exposed will be able to go in and request a test without having symptoms. And we want to get to that point because I'm sure you've heard that it's been reported that anywhere from 20 to 25% of the people who have been infected and are positive, if they were tested, have no symptoms. They're people that are walking among us. I could be one of them. Anybody in my office could be one of them. Are walking around feeling just fine, having no symptoms whatsoever, being infected, having the capacity to spread the virus to other people. And that's where all the measures we have put into place, including the face covering, comes from. Because there's so many people that will not be tested based on symptoms, right, because they don't have them, that we at some point need to get to those folks. And by doing community-wide testing and not having any requirements you know, to test, you know, individuals will help us, you know, then get to that point where we're catching those folks and identifying them. So the day will come, but again, we're so behind, and we really need to get those folks who are having symptoms and need to be diagnosed so we can quickly care for them, identify who they've exposed so we can quarantine them, and then, you know, and do everything we have to do from there. That's why the priority is symptomatic individuals.
Thank you.
Thanks. And I know Elizabeth had a follow-up question.
Yes, thank you. Yes, so when we get to that community level, I totally understand what needs to be the immediate priority, but when it's at the community level, I think what will be important is to have some element of prioritization, or to, analogous to the grocery shopping time for seniors or people with disabilities, that if people are not in a situation where they could, well, my understanding is some of these have been by appointment, and I guess that's been in perhaps other states where they were doing the drive-through, but there maybe would be able to be some kind of element of designated timing. But I do realize we're not at that juncture yet. And frankly, although I brought up the issue of accessibility earlier, I realize one of the other important aspects of getting messages out to people in the disability community is people will have to weigh the relative risks of being, even going for the testing, if not necessarily just exposures in going from home to a testing site. So I think several good points were raised in this conversation. Thank you.
And Rita, just a point of clarification, this is Jerry. Again, I believe that the mobile site, I believe you don't have to have, you can be asymptomatic. I believe they're just testing anyone. At least that's how it was communicated on the news report that I saw. So you may want to clarify that and pass that on to the commissioner.
Sure. You're right. I think we're doing both symptomatic folks and community residents who wanted to be tested. You're right.
Okay. Thank you. Do we have any other questions from the board members?
This is Wes. I have a question.
Sure.
So I already asked my question in the chat. Can you see my question in the chat box?
Let me see if I can pull it up. So do you want me to communicate your question?
Yeah, that would be great, Jerry. Thank you.
Great. As I understand that accessibility may be an issue for some of our constituents, and I realize that some people are frustrated with covered masks. Is there any way that the Boston Public Health Commission can encourage clear masks? Some folks rely on lip reading or facial expressions when one speaks.
That's a really, really, really good question and point. Yeah. I'm sure we can. I can pass it on to our team and see. It'll probably be hard for the general public to do that, but I can see, being critical in places like healthcare settings, businesses, supermarket, and places like that, the bank. All the places where people receive services, that having those clear masks and having the ability to act, to have the visual of people's lips would be really important. So thank you for bringing that up. I'll make note of it and figure out, what places we can insert that. And I'm sure Commissioner McCosh, this is something that would definitely we need to bring into your recovery plan, and those of other city government and essential services, so they can incorporate it and highlight it.
Thank you. I know Zari has a comment. Oh, apparently she's left the meeting, so maybe she'll come back and we can get her comment at a later time. Any other questions from the board members? Hearing or seeing none, any questions from members of the public who may be on the meeting? Hearing or seeing none, I guess we could say thank you, Rita, for that update, and thank you for all you're doing for helping the residents of Boston deal with the COVID-19 crisis. And I know you'll be working closely with the commissioner and her staff and keeping us informed. And if there's any way that we can help you either now or post-COVID, hopefully sooner rather than later, we can, you can communicate that through the commissioner's office. We did have one comment from the public, I guess. Dolores? Hello? Dolores? Hearing,
Be sure you're not on mute.
all right, well, again, we don't want to keep you, Rita, so thank you very much for...
Here I am. I just
here we are, Dolores. There you go.
I just wanted to say that when I see the mayor on TV and the governor on TV, and they have the, the ESL people, the ASL, whatever it is, people, I do notice that they're not wearing masks. And I wondered, why. I know that they couldn't, but I was very aware that they were unable to wear them while they're speaking out in public like that. So I think that was an excellent suggestion about the masks.
Yeah. Yeah, I wondered too why they were wearing masks, and it took me a second to realize why. That was a great comment. And I'm delighted to have had the chance to be part of the meeting, and would definitely love to come back to this group through the commissioner or directly to get your feedback on some of our planning, in the recovery phase. Really appreciate all your thoughts and comments, and they've been very helpful.
Rita, do you have just one more second? Zari has joined the meeting again, and I know she has a comment.
Sure.
Go ahead, Zari.
Hi, sorry about that. I got cut, so I don't know if you heard me, but the clear masks, we have them at Mass General. We ordered them from a local company, and now everybody else is trying to order them, and they have to wait till the supplies come. Now, one thing I just wanted to make sure people understand is that even if we have a clear mask, they're only used in units where a patient does not have a COVID-19 symptom, because they're not N95 masks, so they cannot be used in the COVID units.
Well, thank you for sharing that. Did you say Mass General?
Yes.
Okay. If you have any more information about the company and you want to share with Commissioner McCarthy, that'd be great.
Yes.
So we can look into it. But it sounds like they can be used as face covering, which they don't offer the protection of a N95, but they're more about making sure that if I happen to be one of those asymptomatic folks that is positive, that at least I'm minimizing by putting a face covering, the amount of droplets that I'm putting out on the in the air. So they serve a purpose, so that's great. And they will, so they serve the purpose of face covering, which is something most people need, regular people.
Well, again, Rita, thank you so much for taking so much time to update us. And again, I know you'll be working closely with the commissioner and her staff and us on the rest of the surge and the aftermath. So we look forward to continuing working with you. So
thank you. Me as well. Have a good evening and be well and stay safe, everybody. Bye-bye.
Thank you so much. And moving right along, my report will just be very brief. I just want to make sure that everybody is safe out there and doing what they can and continuing to be safe and taking care of yourself, staying home, as much as possible, trying to limit your contacts with folks, but also making sure that you're getting your needs met in terms of, access to food, access to PCAs, and whatnot. And if you're having any challenges with those issues, please let the commissioner and her staff know, and we'll try to get you the help that you need. Towards that end, the ride is actually going to be opening up an exciting program in the next few days, and I will certainly communicate when it's gone live. But they're actually going to be providing trips for PCAs. We've heard through the grapevine, through BCIL and other sources, that some PCA users are having troubles getting their shifts filled because their PCAs are concerned with getting exposed traveling to and from the PCA user's house. So we will, the T will be transporting PCAs at the cost of a normal ride fare. And when you're able to book those trips, I will certainly communicate it to folks so that they know that they can utilize that. But the ride has reached out to the RTAG group specifically. They're down about 90% in terms of ridership, so they're trying to think of creative ways to utilize the ride vans in the paratransit service in this time, and that's one way that we've come up with that they can utilize the vans. They're also trying to think about trying to help with food delivery and whatnot. There's been some challenges with that though, because the drivers aren't allowed to go door to door, and a lot of the food delivery services in the city go door to door. So that's another issue that they're working with. But again, hopefully they can solve that issue, and food security is another thing that they can help with. So and again, when the PCA trips go live, I will certainly communicate that to the commissioner, and we can broadcast that to our larger groups. But that's my brief report. And again, just everybody stay safe. And now it's the commissioner's report.
Jerry, I believe Zari had a comment about the ride.
Sure, go ahead, Zari.
Hi, I just wanted to let people know that if you're on a subscription and you're interview was scheduled sometime soon. They're giving extension for those interviews, at least until September, and then they will reach back out to see if you can make it or not. But just so people are not worried that they're going to lose their eligibility.
Oh, yes. Yes, the RIDE has implemented several different measures. There, thank you for that reminder, Zari. They are extending folks' eligibility at least 3 months so that you don't have to worry about going in for in-person interviews during this time. And they, that's just one of the other measures that the RIDE is taking at this time. So, and Elizabeth, you had a question?
Yes, thanks for that update, Jerry. And that is very helpful to know and exciting that that the RIDE is looking for other ways to utilize their drivers. I wonder if there might they might also think of I don't know, would need some better terminology of what to call it, but not exactly a courier service, but if there was something other than food or pharmacy items, but that was like some kind of an equipment item or something that again might be a challenge to procure, if there might be some other kind of way that that those services could be utilized. Although again, I know what you're saying, if it's not door to door, but there that is a potential limitation. But I'm just trying to, I just recognize there could be some items that people with disabilities might need, but that might not fall under a service that's already provided. That they know right now don't have, if public transportation is how they got around, or with the need to try to stay at home, that there might be some other kinds of what I'll call equipment or supplies that might not fit under a delivery designation, but just another category to be thinking of.
Sure. If anybody on the commission has something that they feel like the RIDE, it would be a good use of paratransit in this time of reduced ridership and where they're trying to utilize the vehicles and the drivers. Feel free to let me or the commissioner and her staff know, and I can communicate that to OTA. But I do know that for right now they're looking to get the PCA trips off the ground and go from there. So, any other questions for me before we move on to the commissioner's report? Okay, and now the commissioner's report.
Thanks, Jerry. To follow up on that comment, Elizabeth, there is one program that we heard of through the Age Strong Commission. There was a company called Nesterly, which was doing matches for people who are older, senior citizens who lived alone, where they could take in a renter at like a really cheap rent, maybe like a college student or a single person, to make the most use of their space. Well, that program's been suspended now just because of the stay-at-home orders. So some of the people involved in that program and the company Nesterly are putting out a call for volunteers to do errands, grocery shopping, or pick up other things, pharmacy needs that people who can't get out to get them are doing. So they're going to be doing that moving forward. So we'll put, I believe we've gotten that information out in our newsletter, but we can send it all out to the commission directly. So that could be a very helpful service for people with
that would be
disabilities.
great.
Yeah, it sounds like an incredible service. So,
Commissioner, sorry to jump in. If I believe all our board members get our newsletter, and if you don't, please let me know. But for those of you who are looking for that service, it's the third link under what's happening in City Hall. It says Good Neighbor, a free platform that connects residents. And if you need more information, you can contact our office.
Great. And Olivia, do you have a comment about this program? You can jump in.
I've got a comment about a program I know of that would be extremely beneficial to people. If you are a recipient, if you get your health insurance through OneCare and your plan is Commonwealth Care Alliance, they are now providing $100 to nationsotc.com/CCA, where you can order things like food, household products, health, medicine, and personal care items, and they deliver it to your door.
Great, thank you for that. We can look for a link and get that out to people as well. So other updates, first of all, I can talk about my office. Myself and my staff are all working from home now, but we are still working full time. Our phone line has been transferred to staff. We can also get faxes, so we're still doing our accessible parking program. On that note, we have been working with the BTD, Boston Transportation Department. I don't know if many of you have seen, but the mayor has made some adjustments in parking regulations. And one of them is that people who have expired disability placards will not be ticketed for parking in accessible spaces at this point, at least through May 4th, and likely, longer than that. So you can spread the word about that. We've also been getting that information out, but expired placards people will not have to renew them right now. In fact, the registry isn't even renewing licenses, so people can not stress out about renewing their placards at this time. Other work that we're doing, working closely with Chief Martinez, the Chief of the Health and Human Services Cabinet, working with Age Strong and the Boston Public Health Commission to make sure that all residents with disabilities have what they need. Our biggest request in the early days after the stay-at-home order was for food. And so we're working closely with the Office of Food Access, who is delivering meals to people with disabilities who can't get out, not meals, but groceries. The mayor has also extended grocery pickup sites and expanded meals from just Boston Public School students to families who may need groceries as well. So we're continually working to get more resources out to the community and more information out to the community. A couple things that I'm doing specifically, I do have a call 3 times a week with Mass Health in regards to long-term care services and supports, and this is people who use PCAs. We work on getting updates from the state, and if any of you use PCAs, you may have heard about some of the updates, but some very important updates have taken place. First of all, PCAs can now work overtime hours and not be penalized. Previously to the pandemic, PCAs could only work a maximum of 50 hours a week, and they couldn't get paid for anything over and above that. But now that cap has been lifted. So if people only have one PCA and they're approved for 55 hours a week, that one PCA can work all of those hours right now and not be penalized. Additionally, PCAs were given a 10% pay raise for the course of the pandemic. I believe that goes through June. So if anybody doesn't know about that, has been implemented retroactive to April 1st. So we'll continue to push these updates out as we get them, but the state is doing everything it can to ensure that people with disabilities don't end up in the hospital. And one of the biggest issues that we've run into in that sense is getting PPE for people with disabilities to give to their PCAs. So we were able to work with the Boston Public Health Commission to get tens of thousands of masks out to SEIU, which is the union that oversees the PCAs. So they set up a distribution center to get masks out to PCAs in the city of Boston. So we're hoping that that will go a long way towards keeping residents safe and ensuring that they don't end up in the hospital during this pandemic. If you need any PPEs yourself, you can let us know. We can try to help with individual requests as needed. We don't have direct supplies in our office, but we can try to link you up with an agency that does have them if need be. Another call that I do weekly is with the Boston Public Health Commission to talk about facilities and to monitor the outbreaks in different facilities in the city of Boston. As I'm sure you've all heard, and as Rita mentioned, nursing homes and long-term care facilities have been adversely impacted by the coronavirus. At one point, I saw a statistic that said 52% of fatalities in the state have been in nursing homes. So it seems like when a case breaks out in a nursing home, it just runs rampant through the whole facility. So we're trying to monitor BHA, Boston Housing Authority buildings, the elderly and disabled buildings through BHA, also nursing homes, long-term care, assisted living in the city of Boston, to respond quickly if there's an outbreak, do emergency assessments, and try to contain the outbreaks as much as possible. I'm also doing a bi-weekly call with the other disability commissioners from across the country. Like I said, we're all trying to come up with innovative ways to serve our communities. Talking about food delivery is one of the biggest things that we have heard from residents. Also, the inability to use EBT cards remotely, either online or through delivery, has been an issue. So working with food access to try to overcome the barriers that people are facing, whether we can try to work on systemically getting that policy adjusted during this time, or just trying to get people who need food to get them food. So the other cities are dealing with the same things that we are dealing with. I'm talking with the commissioners from New York, Chicago, LA, some in Texas, Philadelphia, Baltimore, St. Louis. And we all have similar issues because we all live in pretty dense cities with public transportation, and most of these cities are also on stay-at-home orders. So we're all struggling to try to serve our community, but trying to come up with creative ways, and we're sharing ideas about how to do that. Another call that I'm doing is with Partners Healthcare, Spalding specifically, Oz and Sherry Blowett, just to share best practices about telehealth and keeping people with disabilities out of the hospital. Access to PCAs and PPEs is one of the biggest things that we need to work on, and we'll continue to work on moving forward. Other than that, we will also be working on a recovery plan, as Rita stated. Right now, we're trying to deal with immediate needs and just keep everybody safe as we move through the surge. This week and next week is expected to be the biggest surge in new cases. So I'm sure you all may have heard that the BCEC has set up a field hospital. I believe Rita mentioned that they can serve 1,000 patients, 500 with COVID and 500 for homeless people. So another community we're worried about is people who are homeless, because we know a lot of them have disabilities, physical and mental health. So we're keeping an eye on that as well. And then trying to also get out messaging. We're doing a lot of social media, a lot of outreach. We recently were able to link in with the Age Strong Commission to get some telephone numbers of people with disabilities on their list, to get messages from Mayor Walsh about staying in, washing hands, wearing a mask, staying safe. So trying to just get as much information out to the community as we can. And I will just add on Wes's comment about the face masks and people who read lips or people who are deaf. We've actually heard that from residents in the community, and it's something that we will definitely look into and try to figure out ways to address it, whether it may be coming up with some outreach campaigns, or just trying to work with MCDHH to see if they have any ideas and solutions, because we know that is a critical issue as well. So thank you for raising that, Wes, and just to let you know, we will be working on that. So anyway, COVID-19 has taken up the majority of our work. I'm also doing a weekly message in our newsletter with updates and just trying to keep people's spirits up, because we know mental health is a real issue these days. It doesn't get as much attention as our physical health, but we know it's just as important. So we're trying to direct people to mental health resources as needed. So all the information we share with you in our newsletters and in emails, please get it out to your networks so that everybody knows that the mayor and his team is working on it. I think Mayor Walsh is doing a great job. In a matter of days, he had a make these huge changes in the city. Everything from sending home all the staff in City Hall, except for a handful of critical employees who had to be in the building. He closed the schools. He had to close businesses, issue stay-at-home orders for residents. And really, it's been a pretty smooth sailing. We haven't had a lot of panic. We haven't had a lot of violence. We had a few exceptions over the weekend, which was really disappointing. But the mayor is coming up with a lot of initiatives to address the issues that we're dealing with, expanding food sites, expanding testing sites, lifting delaying property taxes, putting in protections for landlords and renters. So really the city is coming together to work on immediate initiatives that will help people get through the short term, and then we'll certainly be looking at longer term as we move ahead. And with that, I know we've been on the call for a long time, so I'll wrap up my report here. Just throw it over to Jessica to see if she has anything important to add, and then I'm happy to take some questions.
Thank you, Commissioner. I don't have anything to add other than please feel free to reach out to us. If you or anyone in your community is running into a barrier of any kind, accessing PPEs, accessing food, getting the things that you need, getting equipment, anything and everything, don't feel like anything is too big or too small to ask. Please reach out to our office. Either by email or frankly, you've got Commissioner and my contact info. Commissioner and I are mostly for working around the clock. I'm not sure that we're great on knowing which days are work days and which days are the weekend anymore. So please feel free to reach out to us. We're here for you guys and we're here for the community. So if you or anybody in the community hears any concerns, please let us know.
Great, thank you so much. I know Elizabeth had a question.
Just one possible thought about that issue that Wes raised about the clear masks. Although that might be a challenge within the wider community to have clear masks, a colleague of mine who has a disability had forwarded a link on a do-it-yourself face shield that we're accustomed to seeing those when they show videos from in the hospital of the doctors and nurses, the people on the front lines wearing masks and a face shield. And this one was made, I think, out of a Polar solar soda bottle. And I was just saying to her that I think before I would bring that forward to the commission or elsewhere, I'd like to see a prototype to see if the edges of that, how workable that is. And as I discussed with her, I think it really might be brand specific, that as many of us are familiar that water bottles, the plastic water bottles come in various degrees of how thick the plastic is. But in any case, Wes, I can get that directly to you for the do-it-yourself one, but as just a quick troubleshooting, that's the first thing that comes to mind. As I don't know that it would completely, it's not perhaps as protective as a face mask if it's done without, just to have a face shield, but it would at least, if people are doing social distancing, it might at least be one interim solution if there are people who know each other but are trying to communicate a little bit more easily.
Yes, that would be great. This is Wes, yes, thank you.
Any other questions? All right, Jerry, just a little update on the agenda, just because it's been a long conversation and I'm sure people have things to get to.
Yeah.
We can skip the architectural access report. There wasn't a lot of updates anyway. And we can email anything to the board that we have to share.
Yeah, not a problem at all. I really appreciate everybody, being on on the call, and I think this alternative format, especially for our first meeting, went very well. Hopefully, we won't have to utilize it much longer, but now we know that it is available to us as a good resource. And please, give the commissioner or myself any feedback around the meeting that you have. The only other thing that I had, just around food access, I've availed myself of an agency in the city that actually I was told provides food service and meal deliveries for every part of the city. So anybody who is having some food insecurity issues, please feel free to call Ethos. And their phone number is 617-522-6700, and see if they have any programs that might that might fit you and be able to hook you up with some resources. And I also know that the Greater Boston Food Bank has encouraged folks to use 211 as a link to food resources as well. So those are just on top of any resources that the commissioner's already mentioned.
Can I just add, Jerry, that I think the overall message we want to get out to people, and we want you to get out to people, is that there is help available. I don't want anyone with a disability to be sitting at home hungry, sitting at home worried. Whether it's Ethos or a food bank or something the city can do, we will find resources for people to the best extent that we can. So please get that message out that we are here to support people. We know it's a really perilous time, and some people need support, and that's really what we're here for, and that's what the mayor is doing with his initiative. So we want to be here to help people. So please, all of you, share that message to your networks.
Great, and we really appreciate the work that you're doing, Commissioner, and Jessica and the staff are doing. I know you've done great work with hooking everyone up with PPEs and whatnot. So that's great. And any other final comments or questions from the board? Hearing none, I think we've just had our first
Jerry, maybe public comment?
Oh, any public comment from the public, Dolores or anyone else who have joined us?
I make a motion to adjourn. This is Carl.
Okay.
I have to do that.
All right, not a problem. And again, I think we've just had our first successful remote meeting. Great job, everyone. And do I hear a second to Carl's motion to adjourn? I can't believe no one's seconding the motion to adjourn.
Okay, here's Ducey. I'll second this.
I was going to do it twice if nobody else jumped in.
Not a problem. All in favor?
Aye.
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 All right. Thank you, everyone. And again, just to echo Jessica and the commissioner's comments, if you need help or you know of anybody that needs help for any reason, please feel free to reach out, and we'll try to get you the help you need. And I will certainly, once the PCA trips are live for on the ride, I will let everybody know. Thanks, everybody, and stay safe, please.
Have a good night, everyone.
Thank you. Good night.